Okay, good afternoon, everyone, and thank you for being here. I'm very happy and excited to host today's webinar. For those who don't know me, allow me to introduce myself. My name is Hala Tajrine. I'm the clinical dietitian here at American Wellness Center. And today I wanted to talk a little bit more about obesity in depth and the different aspects that are involved. So first, I will talk about some medications because there have been a lot in the news lately. We've been hearing a lot about them. Then I want to talk about the BMI. Then I want to present some studies, and I will give you some ways at the end to help you regulate your appetite. And of course, we will have a nice discussion and question period. I will also leave my email at the end. So if you have any comments, any questions, please feel free to reach out. I'll be more than happy to get back to you. And if you have any questions throughout the presentation, please, you can put them in the chat box, type them, and I'll be also happy to answer them at the end of the presentation. So talking about these obesity medications, maybe you've seen what they look like. They've been a lot on the news lately. Oprah mentioned a few weeks back that she's been on them on and off. They basically look like a pen and they're taken through injection. And basically we call them glucagon-like peptide receptors, or GLP-1 receptor antagonists for short. And this is how they work. Basically, they work at the brain level in suppressing the appetite. And they also work at the pancreatic level in making your insulin more responsive and more alert. And that results in improved hyperglycemia. And glycemia is, of course, the blood glucose in the bloodstream. So if we have improved glycemia, this all results in weight loss. So this is in a simple way how it works. We can also think of these medications as working in other different ways. First of all, at the pancreatic level and at the stomach level. So first of all, at the pancreatic level, we notice that they enhance insulin secretion. So it's like thinking your insulin is more alert, it's acting better, and that's why it helps in the uptake of blood sugar in the bloodstream. And it also slows gastric emptying. So you can think of this as mimicking you eating slowly. So instead of the food from the stomach being dumped quite directly to the the voice is not clear. Okay, maybe it's the mic. Can you hear me better now? Okay, let me try to get our IT. Or is it better now? Okay, if it's not, please let me know if it keeps interrupting. So as I was saying, the way that these, okay, perfect. Thank you. So the way these obesity medications work is that they enhance the insulin secretion at the pancreatic level. So your insulin is more active and it slows the gastric emptying. So it like mimics you eating slowly. So instead of the food being dumped all at once in the small intestine, it is diffused very slowly. And these two mechanisms make that you get better glucose monitoring overall. So when you have good blood glucose monitoring, your blood glucose is not going up and down. Oh, okay, perfect. Okay, so we were talking about the obesity drug medications. Basically, like I said, they work at the pancreatic level and at the stomach level in slowing the gastric emptying. And they look like a pen. They are usually given through an injection, and they basically mimic the role of the hormone in the body. That's kind of how they work. And in terms of their dosage, they can be given either once a day or once a week. It really depends on your specific case. And there are different subcategories or families of these drugs. If you would like to know more about these drug medication, I invite you to consult with our endocrinologist here, Dr. Niaz. Him and I collaborate a lot together, and he can, guide you as to what is the best medication to you and what is the best dosage and so on and so forth in terms of all the medical aspects of the medication. So the benefits, like I said, that are known and are have been shown through several studies are, of course, weight loss and improved blood glucose levels. So we have these two, and a lot of studies show that patients who are on these medications, they do see significant weight loss, as we'll see later on in a graph. In terms of other benefits, we also notice that there's improved hypertension, there is improved cardiovascular risk, and there is improved blood cholesterol levels. So all of this comes under the umbrella of weight loss, because we know that once we have a 10% weight loss, this also comes with the package that our blood pressure is better, our cardiac risk is better, and our blood cholesterol is also decreased. So all of this comes under the same umbrella of weight loss. Other potential benefits by taking these medications are slowing down of the fatty liver disease. So if someone has a fatty liver, we notice that the progression of the disease is slowed down when you're on these medications. And this is mainly because you have improved blood glucose levels. Same thing for the kidney and the kidney damage or the nephron damage. Because we have improved the blood glucose, and when we have very high blood glucose, we notice that the nephrons, because they're very sensitive, they tend to get damaged. But when we have better blood glucose monitoring, when we are on these medications, this also slows down the progression of this. So this is also another benefit of taking these medications. Now, some side effects are, decreased appetite, but this is fine with some patients because that's ultimately the result they want. Some patients say that the ones I've seen in the clinic, that they have some nausea, some episodes of vomiting, but this is mainly when they take a very large meal or a meal that is very high in fat. It tends not to sit so well with them. This is kind of what they relate to me. Some patients do experience also dizziness or headaches, and some patients may have diarrhea, and very few have raised the issue that they have increased heart palpitation or tachycardia. So now, moving on to the results of these medications, we notice that there is a significant weight decrease, almost 15 to 20%, and that's what is quite interesting about these medications. If we look at this graph, here it shows us, it's a very interesting graph, where in the red bar we notice the patients who were treated with the medication, and in the blue bar we see the patients who were taking only placebo or diet and exercise alone. Because, as dietitians now, we know that even with obesity management, we cannot rely on diet and exercise alone. In some cases, it really helps to get pharmacological help or medication for the patient. And then we have in the vertical line the weight loss that is in percentage. And at the horizontal line, we have the times corresponding in weeks. So the duration of the treatment. And as you notice, when the patient stopped the treatment after a year and a half almost, we noticed that unfortunately with the blue line, the patients who only did diet and exercise alone, these patients gain all of the weight back once they stop the treatment. And whereas the patients who were on the medication, even when they stop the treatment, okay, they do gain some weight, but they don't go back to square zero. And that's why, working in parallel with the medication and the diet and exercise, it's all part of a package to help patients. There was also a doctor who kind of explained it to me in a very simple way. And this is kind of also what we tell patients and how the drugs help with obesity. It's like asking a patient to go up to the 55th floor. We are in Dubai here. There's a lot of towers. If you were to use the stairs to go on the 55th floor, it will be very exhausting. You might reach and you might not reach. Whereas if you were to use the elevator, chances are you will reach your destination. And this is kind of how the medication helps in obesity. But definitely as dietitians, we need to help our patients make better lifestyle changes and make better dietary food choices so that the drug is most effective once they are on and off the treatment, because we don't know when they will stop the treatment, how long they will be on it, and so on. So now I want to move on and discuss the body mass index. If you've been to the clinic, you've seen me use this chart a lot of times. This is the chart that is given by the CDC. And basically, it's calculated using the weight divided by the height in meters squared. So you can calculate perhaps your own BMI. This is just an example. If someone's height is 1.65, then we take 165 times 165. So we take the square of that. We get a number, and then we take the weight, in this case, 85, and we divide 85 by the meter squared, the height squared, and we get a number. For this patient, the number is 31.25. This means that according to the chart, it puts the patient in the obese zone, in the orange zone. So definitely when we have patients in the clinic that are in the red or orange zone, it's a red flag to us, and we try to help them as much as possible, because usually behind the weight, there's also elevated maybe blood lipids, elevated triglycerides, elevated blood pressure, or prediabetes. So in that sense, we need to really take care of these patients. I know that it's not the talk of today, but I also want to mention patients who are in the blue zone, so who are underweight, because I do see them also in the clinic. And these patients tend to be malnourished. Maybe they have iron deficiency anemia or other nutrient deficiencies. It is also a red flag to us, and we try to help them as much as possible by giving dietary advice. And also for these patients, their immunity is also compromised. So it's also a cause of concern. Maybe in the next webinar, I can discuss how to help these patients more in depth and what foods they should consume. But going back to the obesity, like I said, we basically look at metabolic health. So we are looking at the overall health of the patient. It's not about body image or the patient not being, a certain shape or size. It's really all with regards to health. Now, for patients who are in the yellow zone, it's a little bit tricky because we need to look at the overall package. So I don't want you to panic now if you find yourself at BMI 27 or 28, that you are in the overweight zone. Because, for example, if I have a patient who started BMI 40 and he decreased his weight until BMI 27, wow, he already did a great job. There's no, it's okay to let the weight stabilize for a while, and then if we need to decrease the weight. But if he is metabolically okay, then we don't need to dig any further. So we are really looking at metabolic health, not just a number. So the BMI still remains an important part of the puzzle, though it's not the only part. We need to look at other components. So moving on now to highlighting a few studies, which I find very interesting. The first one was talking about the risk factors for death in the US. We looked at different risk factors, and the BMI, which we were talking about earlier, an elevated BMI was shown to be the fourth leading cause of death. So definitely it has its role to play, and we should take it into consideration. Another one was poor diet, and that was seen as the first leading cause of death. So, okay, we know that in North America, maybe we consume more processed foods and fast foods, maybe less fruits and vegetables. So all of this takes into account that poor diet definitely will have an impact. And that's why we should all, regardless if we are which zone of weight we are at, we should aim to improve our diet day in, day out. Another study which I found interesting was looking at the consumption of a Mediterranean diet with having a healthy weight was correlated with a decrease in cardiovascular mortality risk. So basically better heart health. So this was also interesting. If you've seen the webinar on diabetes that I did a couple of months back, we also talked about the Mediterranean diet and how it helps reverse prediabetes. So basically what the Mediterranean diet is a diet that is rich in fresh fruits and vegetables, whole grains and legumes. It's a diet where you consume, where you do a lot of exercise and you're physically active. It's a diet where we consume fresh fish and seafood at least 3 times a week, poultry and eggs twice a week, and we really, really limit the consumption of red meat, processed foods, and refined foods to a minimum. So there are many, many other studies out there that talk about, being in a healthy weight, consuming fresh fruits and vegetables, consuming a diet that is low in processed foods. But I basically wanted to highlight these two before I move on to the last part of the presentation, which is giving you ways to help you regulate your appetite. So the first tip to regulate our appetite is to eat regular meals. So you want to eat every 4 to 6 hours. Ideally, this will help maintain body fuel and energy levels, quite steady. We will not have any spikes. It will decrease your hunger. And also mentally, you will not tend to binge or snack on certain foods. Another tip is to go for protein-containing meals and snacks. So definitely you want to use the meat, chicken, and fish as a base for your meals. Or you can go for cheese and dairy and milk as snacks, maybe, a glass of milk with some cinnamon between your meals. It will help. Or you can add cheese to your salads. Also, you can maybe have Greek yogurt with some high fiber breakfast cereal and some fruits. Also, let's not forget the legumes, which are also very high in protein. Whether it's lentils or beans, you can have them as soups or salad or stews or side dish. So you can just mix and match with the ways that you can consume these foods. Nuts and seeds, of course, you can sprinkle them here and there or have them as a snack. And eggs, of course, because eggs is the best source of protein. It has all the essential amino acids, so it's a complete protein in that sense. So you can either have a quiche maybe for lunch or have a boiled egg as a snack or an omelette in the morning, but try to include eggs on a weekly basis in your diet. Another very important tip is to go for high fiber containing foods. Of course, fiber is very important because it gives a feeling also of fullness, just like the protein gives a feeling of satiety, of fullness. So you want to go for whole grains, whole wheat bread, whole wheat pasta, legumes, so chickpeas, lentils, fresh fruits and vegetables, salads and fruits as snacks, and dried fruits are also good choices to have. And you also want to follow the food plate model. Also, if you've been to the clinic, you've seen me use the food plate model a lot. Basically, the food plate model is when we have 1/4 of a plate consisting of protein, the other quarter consisting of whole grains. So if we were for a lunch meal, you would have perhaps maybe chicken and rice. If we were at breakfast, maybe you would have eggs and bread. So depending, you can choose the choice of source of protein or carbohydrate. But the most important is to have half of your plate filled with fresh fruits and vegetables. And I often discuss this plate quite extensively in the clinic with my patients. I also ask them to take pictures, to record their food intake, and quite often they relay these pictures to me. And today I wanted to share this slide, which shows that whether patients are at work or at a restaurant or at home, you can see quite vividly the vegetables are there, they are present on the plate. And these are real pictures of patients. And depending on their ethnic background, you see they still follow their own preference of food, but we notice that the vegetables are there. So it makes me so happy when I see these pictures, because this is really the ultimate kind of goal and guidelines that I like for them to follow. We don't really do any micro meal planning anymore, where it's about taking a certain grams of this and counting the amounts of grapes that you are having. It's really the overall picture that we want to follow. And also you want to limit the consumption of processed foods and sodas and juices and baked goods and crisps, because these contain a lot of sugar, they have a lot of salt, also they have trans fat, they have zero nutrients. So you really don't want to keep them in the house, you don't want to keep them at work, you don't want to keep them in your in your bag or anywhere near. You really want to avoid having those foods around. I cannot conclude today's talk without talking about the benefits of exercise. Exercise, of course, helps in regulating the appetite, but it's good for your brain, it's good for your muscles, it's good for your bones, and it just helps regulate everything throughout. So it's an important piece of the puzzle as well. So lastly, really to manage your obesity, it helps a lot when maybe you will need medication, maybe you will not, your doctor can better advise you, but definitely when you eat right, you move more and you try to follow some of these tips, it definitely you will be on the right track. So enjoy eating every 4 to 6 hours, enjoy high protein foods, go for high fiber foods, follow the food plate model like I mentioned, try to limit sugary and processed foods as much as possible. So this is very personalized. If you tend to take them every day, then you decrease to once a week. If you take them once a week, you decrease to once every 2 weeks, and so on and so forth. And enjoy regular physical activity as much as possible. So if you follow these steps, luckily, hopefully you will be on the right track. So on that note, I want to thank you so much for listening. I also left my email if you have any questions, or I don't know if we have any questions, I can also answer them right now. I hope you enjoyed today's talk. So we have one question, which is relating to the metabolism. Is it different? Does it matter if we have a high metabolism or a slow metabolism, and does it affect our weight loss? So the answer to that with regards to metabolism is that metabolism is tricky because it's not the only piece of the puzzle, number one. Number two, we have it's part of an invariable factor, because as we age, we will all have a decreased metabolism and we will all age. This thing we cannot change. But what we can do to reverse this is exercise, because when we exercise, we increase the metabolism. And we tend to increase the metabolism for up to 12 hours. That's why for a lot of patients I see in the clinic, I tend to give them or to recommend that they exercise, perhaps do a workout in the morning and go for a walk in the evening. And in that way, they can keep their metabolism up and running. So you don't have to be too much fixated on the metabolism. Maybe your dietitian can help you more based on your own specific profile and lifestyle and meal plan. What's the best meal plan suited for you, because it's not one size fits all. I don't know if we have any questions. Any other questions? Okay. So thank you so much for being here. And I look forward to seeing you soon, and have a happy day ahead. Thank you.